Have you ever wondered why some individuals seem to have an overpowering sense of self-importance, a deep need for excessive attention and admiration, and a lack of empathy for others? These are some of the key traits of narcissism, a personality disorder that's intriguing, often misunderstood, and impactful. Let's delve into the world of narcissism and explore its defining characteristics. But remember, while understanding is the first step, it's essential to approach this topic with empathy and sensitivity. Narcissism, at its core, revolves around an inflated sense of self-importance. Individuals with this trait often have a grandiose sense of self and believe they're superior to others. They have a strong desire to be the center of attention and often exaggerate their achievements and talents. B-roll, footage of a person posing in front of a mirror, admiring themselves. Narcissism can manifest in various ways, such as an excessive need for admiration and a lack of empathy towards others. Narcissists often exploit and manipulate others to fulfill their own needs and desires. They may also have a sense of entitlement and expect special treatment from others. B-roll, footage of a person demanding special treatment and disregarding others' needs. While narcissism is often associated with negative traits, it's important to note that not all individuals with high self-esteem are narcissistic. Healthy self-esteem is based on a realistic assessment of one's abilities and accomplishments without the need for constant validation from others. B-roll, footage of a person confidently engaging in a task without seeking validation from others. In conclusion, narcissism is a personality trait characterized by an inflated sense of self-importance, a desire for attention, and a lack of empathy towards others. It can have negative effects on relationships and overall well-being. However, it's important to differentiate between healthy self-esteem and pathological narcissism. Another key trait of narcissism is the need for constant admiration. Narcissists thrive on praise and will often seek it out. This can sometimes lead to manipulative behavior, as they'll do whatever it takes to maintain their self-esteem and feed their sense of superiority. Lack of empathy is another significant trait. This doesn't mean they're incapable of feeling or understanding emotions. Instead, they struggle to recognize and respond to the feelings and needs of others. This can make it difficult for them to form meaningful relationships. Narcissists also have a sense of entitlement. They expect special treatment and unquestioning compliance with their expectations. They'll often become impatient or angry when they don't receive the special treatment they believe they deserve. Lastly, narcissists often exhibit arrogant or haughty behaviors or attitudes. They might look down on people they perceive as inferior or dismiss the opinions of those who disagree with them. Now that we've covered the main traits of narcissism, the question arises, is there a treatment for this overpowering personality disorder? The answer is complex. Narcissism, like other personality disorders, is deeply ingrained and difficult to change. However, certain therapeutic approaches can help manage narcissistic behavior. Psychotherapy or talk therapy is often the first line of treatment. This approach helps individuals understand and manage their disorder. It can help them learn to relate better with others, understand the cause of their emotions, and cope with feelings of inadequacy or rejection. Cognitive behavioral therapy can also be useful. It helps individuals identify unhealthy, negative beliefs and behaviors and replace them with healthier, positive ones. Keep in mind, though, that treatment success greatly depends on the individual's willingness to acknowledge their narcissism and commit to change. In conclusion, narcissism is a complex personality disorder characterized by a grandiose sense of self, a need for constant admiration, a lack of empathy, a sense of entitlement, and arrogant behaviors. While challenging to treat, with willingness, understanding, and appropriate therapeutic approaches, individuals can manage their narcissistic behaviors and lead healthier, more fulfilling lives.